Hello everyone, I'm Dr. Kamal and today I'm going to talk about the dose, EC50, efficacy and potency of drugs. So it's very important, these are very important whenever you are studying pharmacology. So dose, EC50, efficacy and potency of drug, you must know about these properties of drugs. So let's start with the first, the dose and dosage form, as these two are synonymously used, and you must know the differentiations between dose and dosage. So according to the American Medical Association, a dose refer to a specified amount of medication taken at one time, where a dosage is the prescribed administration of a specific amount, number, and frequency of doses over a specific period of time. Dose, this is just a quantity of drug. It should be taken like either in a milligram. These are the unit, which can be either milligram and a microgram, international units, IU. So many units are used for the drug dose prescriptions. And in other words, you can say the dose is simply an amount, as I mentioned, a medication that is administered at one specific time, while dosage is the doses or amount of drug attached to a time frequency, and dosage guides a drug regimen. So these are the basics definition as well as the differentiation between these two terminologies. Similarly, we have another, let's understand with the help of this therapeutic window, as we know that whenever we have the other things. Okay, let me just. As we know, let's understand the with the help of this therapeutic window. We know about that whenever we are taking medications, administration of medications either through oral route or through IV or enteral routes. So the drug must come to the plasma, to the bloodstream, to the systemic circulation, and we term that as a drug plasma concentration. And there must be in a plasma concentration, there is a therapeutic window. Within that window, we have therapeutic range, and the therapeutic range is associated in between the minimum toxic concentrations and the minimum effective concentration. Now, what are minimum effective concentration? What are minimum toxic concentration? You must know. Minimum effective concentration is the lowest concentration of drug that required to achieve the therapeutic effects, the primary effect of a drug, where the minimum toxic concentration, or we can say the maximum therapeutic concentrations, these are the drug dosage or amount of that produces unwanted or side effects, because and within there we have a therapeutic range where the drug show their therapeutic responses, the primary effects. So whenever the doses of drug increases, we are increasing doses of drugs, so there may be chances it may exceeds to the toxic range here in this range, and we term that these are the what? These are the toxic. These are the toxic ranges here. So the drug may show their side effect or toxicities, or they may appear in the form of secondary effects. So these are all dependent upon the doses of drugs. As mentioned, plasma concentrate amount of drug. So what now we have certain other terminologies that are associated with the therapeutic window. What are that? We have onset of action, right? This is the onset of action. You took like, and this is the time that is taken. Remember that on x-axis we have a time, while the plasma concentration on the y-axis, and it reached to the maximum plasma concentration. We term that this is the maximum plasma concentration. We call that what? Maximum plasma concentration. And within this we have therapeutic responses. Below that, we have subtherapeutic range. The drug will not show any therapeutic efficacy. And whenever it reaches to the maximum concentration, then its metabolism, distributions, elimination starts, and the drug depleted from the body, like in this manner, in this way. And again, you have to take here, like whenever it reaches 2-3 hours, you have to take another dose of the drug, so that we can get again the drug into the plasma concentration. After 3, like 4, 5, 6 hours, again we have to take another dose of the drug, and this is the frequency and the schedule of the drugs, the dosage. Now, this is a time schedule is this onset of action, and this is from here to here, like this is the termination point here and here. This is we call duration of action. You will know that duration of action of the drug is like this: 2 hours, 6 hours, 24 hours, 18 hours, 48 hours, like other things. While in the minimum, after that is the termination. This is the termination of action of drugs. This is the termination of action of drugs. And after that, you have to take, as I mentioned, you have to take another dose, another dosage. So this is the therapeutic. You must understand these things. The must know the minimum toxic concentration, minimum effective concentrations, right? So now we have also other terminology that are associated with the dose and dosage. Sometimes we call adult doses. So what are that? Amount of that ordinarily produces the medicinal effect intended in the adult, while pediatric amount that produces medicinal effect intended in the infant or child patients. Similarly, you will dosage range. A number of medication dosage forms are available in various dosage range or dose concentrations, like 50 milligram. Some are available in 50 milligrams, some will have 75 milligrams, some will have 100 milligram, some will have like most of the antibiotic, as you have seen, that mostly they're available either in 250 milligram or 500 milligram, 625 milligram or 1 gram, like that. So it depends on the situation. If the patient situation is worse, they have like so they need a larger amount of drug and high concentration of drugs. But if the condition is not like that much, so must have to keep the patient in a low dosage. So these are the quantitative range amount of drug that may be prescribed in the guideline that is usual in medical practices. Similarly, median effective doses, we call that MED, minimum effective dose, or you can say EC50. The amount that produces the maximum effects in 50% of the individual tested, or you can say that produces the desired intensity or effects in the 50% of the individual tested. So we call it medium effective dose, MED or EC50. Now let's come to the there is another terminology, pathology. This is it's a terminology is used is for the it's from the Greek word posos, mean how much in the logic study. The branch of pharmacy, the branch of medicine that are concerned with the determination of appropriate doses of a drug or agents, we call it pathologies are, and a Greek posos mean how much. So it most pathology most to determine the dosage of the dose and dosage. Children doses calculation is there's another terminology you must know about whenever you are an pathologist. So you must know that how the most of the drugs that are available in the market are for the adult doses. So you have to calculate the doses according to for the children or the infants, as they have low body weight, the weight is low, is the height is low, the surface area is low. So you must calculate the dosage for the children on the basis of these formulas available. Young formula mostly used under 12 years of children, and for the help of this you can calculate like the dose for a child, like age in year divided by age plus 12 into the doses. Similar dealing formulas under 1 to 4 to 20 years of children, and this is the dose of child, age plus year, and you can see the differences here. 20 into the doses, it will give you the dose of a child under 4 or 20 years. And similarly, Freud's formula, dose of a child, age and month, you can say, and This is the adult doses. You can say the adult doses here. From a clinical dose for a child can be calculated from here. Similarly, we have certain other potency. Is that this terminology is used very much in potency, and student must know the differences between these two things, that you must know about potency and efficacy. These are very used for the potency. So how you can define a potency? The strength of an intoxicant or drug is measured by the amount needed to produce a certain response. What is that? So let's elaborate it further. A measure of the amount of drug necessary to produce an effect of a given magnitude. Let's suppose with the help of this diagram, we can understand it better. This is the percent response. You must know about the EC50 is here. As I mentioned, this is the concentration that producing an effect that is 50% of the maximum. So EC50, effective concentration 50, it produces 50 effects in 50% of the population, of the 50% of the maximum. The maximum, you can say the maximum, 50% of the maximum. If this is the 100, so 50 is the 50% is the it's 50%. So we can say that it's the EC50 is the concentration for an effect that is 50% of the maximum. Now, what happens? What is in these figures? We have 4 drugs: drug A, B, C, D. Now, the basis of like potency is the strength of an intoxicant or drug, at a measure of amount of drug necessary to produce an effect of a given magnitude. I need EC50 here. You can see, and this is the concentrations. These are the concentrations. So the drug A produce 50 EC50 maximum effects, 50% of the effects, the maximum effects within this concentration. Drug B produce it like in 1.5. Drug C produced it in 10, and drug D produced it in this range, maybe in 50 or 70 or some other things. So which one is more potent? The drug A is more potent than drug B, and drug C and D, and drug B is more potent than drug C, and similarly drug C is more potent than drug D. So this is called the potency of a drug. So it increases in this manner, right? So what happens? Drug A is more potent than drug B because less drug A is needed. Less drug A is needed, you can see here, to produce 50% of the maximum therapeutic effects, 50% of the maximum therapeutic effects as compared to the drug B. So this is the potency. So hope so you understand, you got the basic logic or the basic concept of potency. Now let's suppose this is the we have efficacy. Efficacy, how we can ability to produce a desired or intended results. And simple word we can say this is the ability that produces a desired and intended results. And this is the ability of a drug to produce a physiological response when it interacts with the receptors. So we term that efficacy. Let's understand with the help of this diagram. So again, we know that if EC50. So what happens? We have 4 drugs A, B, C, D. So this is the EC50. It's the concentration that produces EC50. Now here you can see drug A, EC50 can be achieved like from this concentrations, right? While the drug B that produces, like here, you can see the EC50 is maximum therapeutic effect is little, the efficacy is lower than drug A, than drug A, and similarly the drug C have here, and similarly the drug D have here, the EC50. So this is the ability of drug to produce a physiologic response when it interacts with the receptors. So this is the drug A is what? Efficacy is dependent on the number of drug receptor complexes formed and efficiency of the coupling of receptor activation to cellular response. So the EC50 increases. Here drug A is having high efficacy as compared to drug D have a low efficacy, and is again it's in the same EC50, like in the same EC50. So you can compare. So efficacy increases like in this manner. So to the maximal velocity for enzyme catalyzed reaction, the maximal response Emax or efficacy is more important than drug potency, right? So the maximal, that is another things. Just understand with the help of, again, EC50, understand with the help of this this diagram. Percentage of maximal effect, right? The drug A and drug B. The EC50 here for the drug is a concentration of drug that produces a response equal to the 50% of the maximal response. And drug B, you can see the EC50 is here. The 50%, the drug A produces 50 within a very low drug concentration, while the drug B produces the EC50 in a very little higher concentration than from the first one. So the EC50 can be calculated, effective concentration can be calculated on the basis of doses. Again, the potency, as I mentioned, potency, you can see that this is the EC50, is the EC50, and this is again the drug doses. So drug A is more potent than drug B, right? It's produces 50% in a very low doses as compared to this one. And this is a comparison, like you can see here, drug A is more potent than drug B. Both show, but both show the same efficacy. You can see from here. Now here we can understand that drug A and drug B, right? Drug A is more potent than drug B, right? This is more potent, as you can see the EC50 as compared with this one. But both shows the same efficacy. The 50% efficacy. Efficacy is the same efficacy, but here drug C show lower potency. The potency then drug A and B, you can see it's a, but the efficacy then drug A and lower efficacy than drug A and B. Efficacy is lower than drug A and B. Efficacy is more efficacious. This is more lower efficacy than drug A and B. What is this? DC show lower potency and lower efficacy, right? Well, drug A and drug B, they are equal and efficacy, same efficacy. You can see EC50 for drug, EC50 for drug A, EC50 for drug B, it's drug concentrations. So both are similar, you can see from here. So these are all about the dose, EC50, efficacy, and potency. So if you have any question, you can drop here in the comments, as well as I will also share this on my YouTube channel. Thank you so much.